Welcome to our talk about exercise and cancer survivorship. My name is Becky, and I'm very happy to be able to have the opportunity to speak with you all today. Um, just to kind of, dive right into it, I do I have my presentation prepared for you, and I want to leave some time towards the end with any questions or answers. Yeah, let's get to it. Here we go. Oops. Okay. So first things first, I do want to introduce myself. I'm Becky. I'm an exercise physiologist in cardiac and pulmonary rehab at the Gloria Drummond Center. This is actually my 14th year working here. Um, I'm a clinical exercise physiologist and I'm a certified cancer exercise specialist. Clinical exercise physiology specializes in the study of the human body and how they respond to exercise and physical activity. In cardiac rehab, we aim to help individuals improve their physical fitness, manage chronic conditions, and prevent injuries. I myself am very honored to have been asked to do this talk today because I am a cancer survivor. I was diagnosed with breast cancer August 17th, actually, of 2023. In addition to my additional diagnosis or cancer diagnosis, I was diagnosed with Cowden syndrome, which carries an increased risk of additional cancers throughout the rest of my life. I had a double mastectomy with reconstruction on October 19th. I had my third and final surgery June of this year. I am 36 years old and I am navigating hormone therapy and menopause. And like I had mentioned, I obtained my cancer exercise specialist certification March of 2024. And again, I'm just so honored and privileged to be able to teach the exercise and cancer class and the after breast cancer fitness classes here at LCI. After my diagnosis, I was felt very strongly about being able to give back to patients and helping them regain a quality of life that many probably think is not possible. Before I dive into the rest of this, I actually looked up on ChatGPT this morning on the definition of what a cancer survivor is. Because depending on how you look at it, there could be many different options or many different definitions as far as it goes. ChatGPT gave me this answer. A cancer survivor is generally defined as anyone who has been diagnosed with cancer and still living. This could mean someone who has just been diagnosed and is starting treatment, someone actively going through treatment, someone who's finished treatment and is in remission, or someone living with cancer as a chronic condition. When you break this down into a medical definition, a cancer survivor is anyone who has been diagnosed with cancer and still alive. This includes your moment of diagnosis, going through treatment, or living with cancer long term. The survivorship phase can include follow-up care, managing side effects, monitoring for recurrence, and maintaining your health after treatment. As a personal or empowering definition, a cancer survivor is usually considered more personal and symbolic. Many call themselves a survivor after they've completed treatment and are in remission, reached a milestone, how many years cancer-free they may be, or overcoming the toughest part of their cancer journey. For some, like myself, being a cancer survivor can reflect strength, resilience, and hope. It could be a way of reclaiming your story after the disease. It's up to each of you how or if you identify with the word survivor. I thought that was really powerful to share because I know that there's probably many of you on this lecture today that may be in different stages of your treatment, and I wanted to be able to cover that during this time as well. According to ACSM, which is the American College of Sports Medicine, physical activity and exercise are often used interchangeably. However, they are not synonymous. Physical activity is defined as any bodily movement produced by the contraction of skeletal muscles that result in a substantial increase in caloric requirements over rest energy expenditure. So that just means if you are sitting at rest, and not doing anything, your body is burning as many calories as needed to be able to sit in a chair and not participate in any activity at all. When you get up to do any physical activity, whether it be your activities of daily living around your house, cleaning your kitchen, mopping or sweeping your floor, taking out the garbage, that those type of activities, that is considered physical activity. Exercise is the type of physical activity consisting of planned, structured, and repetitive bodily movement done to improve and or maintain one or more components of physical fitness. Physical fitness has been defined in several ways, but the general definition is the ability to carry out tasks with vigor and alertness without fatigue, ample energy to enjoy leisurely activities, things that you may enjoy. Components of physical fitness are divided into two forms, which are health related or skill related. Health related falls into cardiorespiratory endurance, body composition, muscular strength, muscular endurance, flexibility. And then the others turn into skill related and balance. I do break a lot of these down further on into this talk. Benefits of exercise spread across all aspects of cancer treatment, like I have previously mentioned. This could be pre, during, and post. Benefits include reduced fatigue, positive effects on your physical fitness. You might not be able to walk from your living room to your kitchen without getting overwhelmingly fatigued. But an exercise can actually help increase your strength and stamina as far as to be able to complete a simple task just like that. Exercise also improves body composition, that is, maintaining lean muscle tissue. Muscle is very expensive to the body, and that's where exercise can come in because the more muscle that you're able to maintain wherever you are in your course of treatment, or even after treatment, can help you manage any fatigue or soreness or whatever the case may be further on down the line. Also, there's improvements in quality of life, your physical, emotional, functional, and social quality of life. Also, if you're currently in treatment, exercise can help improve chemotherapy dose tolerance as well as treatment compliance. The more stronger you're going in, the more likely you're able to maintain your treatment compliance or even not have it take any breaks or, whatever that may be. So how exercise helps specifically. Exercise and physical activity have become more accepted by medical professionals as a part of a routine treatment. The best evidence are shown in the following: anxiety, depression, fatigue, quality of life, lymphedema, and physical function. Anxiety, actually, it's shown in several studies that the more vigorously you exercise, the less anxiety you may feel. This is especially evident in the anxiety you may feel actually when you just receive the news that you have cancer. With depression, there's something called the dose response relationship as well between aerobic exercise and protection against depression. Essentially, the simple term for it is the more you exercise, the less depressed you're likely to feel. And fatigue is also, it's self-explanatory for fatigue. Some of the strongest evidence is shown that the forcing yourself to move, whether it's 5, 10, 15 minutes per day, it's more likely to energize you. So again, in future in the for the future talk or future slides, it actually will, be shown a little bit more. Quality of life, and again, the more energized you feel, the better outlook of life that you have. And for lymphedema, this is actually really a good one that I've experienced firsthand. For years, a lot of patients with this particular side effect were told not to exercise. We now know, particularly women or men in this case with breast cancer, and with resistance training especially, that this can help prevent or even improve lymphedema. If you have lymphedema, I would just encourage you to speak with your physician before starting with resistance training, or even wear a sleeve if instructed to do so. If this is also something that you are dealing with, I also encourage you to speak to your doctor about possibly getting into some lymphedema therapy. A little shameless plug here. We do have some phenomenal lymphedema therapists on staff here at Baptist. And physical function, it's really important to be able to go about your daily life. Again, this is shopping, cooking, cleaning, self-care. This is something I preach to my patients over in cardiac rehab. Uh, we do have a lot of modes of exercise that are sitting down, and a lot of patients just want to sit down to do their exercise. The hardest exercise that you can do is to walk. Walking, you have to bear your weight, you have to be able to maintain your weight, and you have to keep all of your muscles working in order to stand upright. So, physical function is a really important thing. More benefits of exercise, things that we probably already know and have heard our entire lives. Exercise lowers your cholesterol, your triglycerides, risk of high blood pressure, inflammation, diabetes, and it's also increasingly shown that exercise lowers your risk of additional cancers and recurrence. Other benefits are improved vascular tone, improved mental well-being, longevity, and exercise also promotes weight loss. Exercise has many of the same benefits for cancer survivors as it does for the general population. There continues to be emerging evidence also that sedentary and screen-based activities are independent risk factors for cancer-specific mortality. In this day and age, I'm guilty. I chat GPT. We do a lot of watching our screens other than getting up and doing any sort of activity outside or inside. So exercise guidelines. So exercise guidelines is pretty much the same thing throughout. Again, no matter where you are within your treatment. It's safe during and after cancer treatment. What you actually want to do is aim for 150 minutes per week of moderately challenging activity or aerobic activity. This is walking. Comes out to 30 minutes per day, 5 times per week. Avoiding inactivity is key. And with my patients, they may not feel, up to doing anything. If you're unable to perform continuous exercise can actually be broken up into intermittent bouts throughout the day. For example, a 10-minute walk up and down your hallway inside your house 3 times a day comes out to 30 minutes per day. The goal should be to continue to build up to a continuous activity as well. The benefits of exercise always far outweigh the risks. And then a general or simple rule that I tell patients, if you feel like you can keep going after 10 minutes, then keep going. And if it doesn't feel good, then stop. And then there's the FIT principle, and I'm going to explain the FIT principle in the next slide. FIT principle is broken down into frequency, intensity, time, and type. A lot of these here that might be mentioned, you want to pick a mode of exercise or something that interests you. You can walk, you can swim, you can ride a bike, you can do an aerobics class. The goal for as far as choosing a mode of exercise is to be able to pick something that will keep you interested. And then as far as frequency goes as well, you want to pick a frequency that you're going to maintain. You don't want to do something 6 to 7 days per week to the point where you burn out. Especially if you may be in some sort of treatment and you hit a low point after treatment, that's usually your body telling you to rest. So it is absolutely 100% okay to rest. Resistance training, we will talk about resistance training further on in my slides. Resistance training should be 2 to 3 days per week with a minimum of 48 hours in between sessions. So you're doing every other day as far as resistance. And flexibility, in my honest opinion, actually should be done every day. For my breast cancer ladies that I speak to here in the ABC class, I do preach that because a lot of times after radiation, to the chest, or anybody that may have had radiation to the chest, you could have, some restriction here. So we want to make sure, that those joints and those muscles stay fluid and stay flexible. Intensity, I will also talk about the RPE scale, which is the rating of perceived exertion scale. But a simple test to do as far as how hard you feel you're working is the talk test. If you're walking with a friend, a family member, a spouse, and you are able to have a comfortable but breathy conversation with them, you're probably working just about right. If you cannot speak one word and you have to stop and take multiple breaks, you're probably working too hard. And then time should always be 30 minutes or more. As a general rule for the American Heart Association, also, we don't really recommend you exceeding 60 minutes of exercise at a time. There's really no benefit to that at all. And then type I mentioned, pick an exercise that would keep you interested throughout. And this is what I was referring to as far as the RPE scale. We do in cardiac rehab show patients an RPE scale of 6 to 20, but just to keep it simple here, we have an RPE scale of 1 to 10. And our emojis here, that would actually be, a good thing to think about. We really want to try to stay within the moderate intensity, maybe creep into vigorous just a little bit, maybe like a 6.5 before you hit a 7. Um, and just to explain it a little bit more, very light intensity. You actually should feel like you're not exercising. You're not doing anything at all. Light, you could probably keep going for hours. Moderate intensity, you're breathing heavily, but again, you can have a conversation. Vigorous, you can speak, but only one word at a time. And maximum intensity should never be your goal. I always refer to patients or share with my patients, maximum intensity are for Olympic athletes and elite athletes, and we're not trying to do that here. For finding motivation, this one really speaks to me a lot. I actually read a book that was referred to me by one of my therapists that was able to complete some prehab on me before my first surgery. It was a book called Moving Through Cancer. And there's a paragraph in there that say many people often say that you don't really know what fatigue is until you had cancer. It is often described as the most common and debilitating side effect of treatment. Um, the one thing that was really a struggle once I started my therapy after all my surgeries was fatigue and often debilitating joint pain. So it's really hard to find the motivation to get up and do something. Um, a cancer diagnosis is often referred to as a teachable moment, um, but it can also be considered a motivational moment. It usually becomes crystal clear what really matters to you in life and what your motivation can be. Most importantly, you are the expert. You know how you feel, you know what you like, and you know what you want to do. And you have to consider what's going to motivate you to get up and move. What you have, you want to be able to pick up your child, you want to be able to walk your daughter or your son down the aisle. You want to be able to run a marathon again. Whatever your goals might be, you have to consider what your motivations are. And always, again, there's more than one approach. Pick what's best for you. Our motivations are unique to each one of us. And like I mentioned, there's a teachable moment versus a motivational moment. And the most important thing that I cannot stress enough is to be honest and give yourself some grace. You just experienced a really tough journey, or you are experiencing a really tough journey, and you have to be kind to yourself. And then last thing, just something to keep it simple as well. Write down things that are important to you to get you to that exercise. This could be a life event happening. You want to lose 10 pounds, you want to buy a new pair of running shoes, or you just flat out feel better when you exercise. And then you could use SMART goals. So SMART goals, we all have heard about this: specific, measurable, achievable, relevant, and time bound. As far as exercise goes after cancer, this could be specific, could be an improvement in a particular area or skill. You want to be able to walk down to the end of your driveway to get your mail. You want to be able to chase your children around the yard. You want to be able to run a marathon like you were doing prior. Um, Measurable could include some way to indicate or suggest progress. You want to be able to walk halfway down your driveway to get your mail by the end of the month. You want to be able to do this within 2 months. Achievable can be accomplished under expected circumstances. You don't want to be able to walk down to the end of your driveway in 3 days. It's probably not going to happen. And usually if you set yourself an unrealistic expectation like that, it could really lead to some discouragement and really kind of really would set you back. Relevant would be worthwhile and applicable. Again, getting your mail, chasing your kids, running a marathon, buying a new pair of shoes. And time bound, have a deadline. And time bound, I'm usually 50-50 on that because slow is better. And again, do something that you enjoy. Do not get stuck on the idea that you must be successful every day. I played softball growing up, and I had a coach that told me, your plan is written in pencil for a reason. Your plan is not written in pen. You can go back and change it. This is just a quote that I actually just thought would be great to share. There are only two ways to live your life. One is as though nothing is a miracle. The other is as though everything is a miracle. Going back to cancer being a motivational or a teachable moment. You again, depending on where you are in your journey, you're able to still be here and you're able to still move your body, whether a little bit at a time or a lot of bit at a time. And that is a miracle. So prehabilitation is kind of a new thing coming around. Um, it just depends on what you have access to, and what you're able to do. Prehab is actually a really good chance to take control of things when they may feel out of control. Again, this is to remind yourself that you're still alive. I'm a big believer in prehabilitation. I'm a big believer in being able to go into a surgery strong and be able to come out strong. The goal here is to improve your physical and emotional well-being before treatment, before surgery even. Um, there are now dozens of studies that show training for treatment is significant and it has measurable and important benefits. Muscle is a use it or lose it tissue, especially after surgery when your activity levels are typically reduced to zero. So having more muscle tissue or muscle mass prior to surgery is most likely going to mean you're going to have more throughout that time. The goal is not necessarily to gain strength, but to maintain your muscle mass again. Protein directly supports muscle growth, so you want to be sure to eat your protein. This was actually a chart or a graph that was posted or published in the Moving Through Cancer book. Um, it was two groups of cancer patients about to start treatment. And one group did prehabilitation, and they did 60 minutes of moderate exercise at home using resistance bands, a stability ball, and did yoga 3 to 4 times per week. The control group was given a handout listing specific exercise to do only. The study was showed that the patients who exercised 60 minutes could walk faster and longer, were stronger and slimmer, and had less anxiety noted throughout their treatment. This showed up as early as the day of surgery and as far into 6 months of treatment. There are many other studies that show those who started exercising after they were diagnosed were more likely to survive their disease. And post-surgery. So after surgery, I use lumpectomy versus mastectomy here as an example, as a breast cancer survivor. The after surgery, focusing on rebuilding your time versus intensity. Healing after surgery is a form of physical work. You're going to be given guidelines to follow by your doctor, regardless of what surgery you may have. You may have had abdominal surgery. You can have, any other form of surgery to remove any cancer that you may have had. So you want to be cautious and follow those guidelines that you're given by your doctor. You want to be cautious with drains, stitches, or wounds. Um, Weeks following surgery are not a time for resistance training. That's usually, again, outlined by your MD and outlined by your doctor. Again, for an example, a lumpectomy versus a mastectomy, you're not really going to heal or take as long to heal after a lumpectomy as you would a mastectomy. And that's not to diminish, or take away, the fact that it is a surgery, but there are other guidelines that need to be followed. And I used an example here of the wall crawl exercise and wall angels as a range of motion exercises. So these are actually some guidelines excuse me, some exercises that you could follow after your surgery to keep that prehab going or to keep that post-rehab going. And you want to be able to continue to monitor, for any lymphedema you may have as well. For chemo, um, good days versus bad days. I did not go through chemo, so I do not want anybody to feel that I am an expert on this, but I do know that there are your good days and are your bad days. And those bad days can usually come sometime after, a few days after your last treatment. Even on your bad days, your goal should be a minimum of 30 minutes for exercise. Your body is meant to be in motion. Although this could be difficult, you can try to just even stand up and march in place for, X amount of minutes at a time. On good days, you're still going to be aiming for 30 minutes, at least 2 days per week of resistance training to try to maintain your muscle mass. And then continue to utilize the talk test or the RPE scale. Okay. And then timing of going through chemotherapy, you also want to work your exercise routine around where you feel the most energy during the day. Do you feel better first thing in the morning? Do you feel better in the evening? That's when you can actually get that in. Okay, radiation. So regular exercise during radiation can help cut the debilitating fatigue most feel after this treatment in half. There are several gold standard studies that actually do support this. The most beneficial would be low intensity, low impact stretching and flexibility. For my breast cancer patients, it might be difficult to complete any upper body resistance. So you want to continue to focus on lower body and aerobic exercise. As mentioned previously, there could be some stiffness in the area that was radiated. So you want to be able to support yourself with gentle stretching, range of motion, and yoga type movements. And most importantly, if you are a swimmer, if you enjoy swimming, you need to be sure to get your doctor's approval before you can go into the water, first of all, and avoid sun the best that you can. And hormone therapy. Hormone therapies do have a proven effect against cancer. Like chemotherapy, hormone therapy is actually also considered a systemic therapy. Patients do have to deal with this for long haul. Again, I am on hormone therapy and I am navigating that every single day. It's different every day, and I'm doing, the best like we all can. So, adverse effects of this therapy may fall into many categories: cardiovascular, metabolic, muscular, skeletal, vasomotor, the hot flashes, sexual health, cognition, and sleep. Side effects of this therapy is the catch-22. You may feel like you shouldn't exercise or cannot exercise, but exercise is the very thing that you should be doing. And then the exercise guidelines remain the same here. You still want to work towards 30 minutes a day, 150 minutes of moderate aerobic activity per week. And then reconstruction surgery, it could just be this slide could just refer to surgeries in general, because no matter what kind of surgery that you have, your surgeries change the way that your muscles are recruited to do physical work. That could be lifting, carrying, pushing. If you have some sort of abdominal surgery, you want to be sure to return to any activity and do some physical therapy to be sure that you're not recruiting additional muscles that aren't meant to do the work that your abdominal muscles are supposed to be doing. Um, This often does lead to injury. And then range of motion exercises again, once you're cleared by your doctor. When I was practicing this talk, I was telling some of my colleagues in cardiac rehab that I really hope that I didn't get emotional when um, when I was speaking. And this is actually one that really gets me because, 2 years ago I was diagnosed myself, and finishing treatment is an incredible accomplishment. Any treatment that you may have had, or surgery that you may have had, or anything, you don't realize what you are capable of until you are faced with a difficult decision like having cancer. Um, I do view it as a little bit of a blessing because I do feel like I can absolutely take on anything now. Um, Perhaps you may have, made it through with grace and courage or even by the skin of your teeth, but you have to recognize your own resilience, and that is powerful. Um, with exercise, excuse me, effects after treatment can likely continue on for an extended period. You want to be able to be sure that you have reasonable expectations of yourself. It's impossible, or excuse me, I got emotional. Apologies. Continuing to exercise can prevent and improve the lingering side effects of this. It is possible to get back to where you were both physically and mentally. Again, as a survivor, you have the choice and the decision to choose how you would like to return to your story. Exercising at the beginning, during, and post treatment should continue to be followed for the rest of your life. Whoever you are, wherever you are, whatever your diagnosis may be, exercise should always be a part of your daily routine. And a big lesson that I've learned as a survivor is that there is a rich and wonderful life after treatment. You may have think that you have had a great life before, but it really honestly is about to get even better. And last but not least, you want to be able to have a plan if you ever fall off the wagon. Have a group that keeps you responsible. I'm a part of a WhatsApp group with a lot of ladies who keep each other, accountable, and we're all doing the best that we can. And then in summary, you want to continue to avoid inactivity and be as physically active as possible, no matter what phase of treatment that you are in. Exercise continues and will always be safe and highly encouraged during and after treatment. And your general recommendations, the takeaway of everything is you want to achieve a minimum of 150 minutes per week of moderate intensity, preferably spread throughout the week. Don't try to do every single day or consecutive days if you are just not feeling it. Resistance training should be 2 to 3 non-consecutive days of per week, targeting all major muscle groups, and stretching, flexibility, and balance for as many days as tolerated. Exercise is modifiable. If you cannot walk, then you find a recumbent bike. If you can swim, swimming is non-weight bearing, and it's usually better on the joints for you as well. And most importantly, start low and start slow. Don't try to run that marathon on the very first day that you're getting back to exercise. Start where it's best for you. And then these are just my resources. And thank you so much. I appreciate it. If anybody has any questions or I see one question here from Anita. Hi, Anita. You mentioned being able to break up exercise into, for example, 10 minutes 3 times per day. If a patient is trying to improve lower body strength, could they, for example, do 10 minutes of squats, lunges in the morning, 10 minutes of hip adduction in the afternoon, 10 minutes of hip thrusts in the evening, or something along those lines? So those would be body weight exercises. That would fall under resistance training. So that could be something that you could do 2 to 3 times per week, but absolutely break up anything, whether it's our aerobic activity or resistance training, um, that feels comfortable for whoever it may be. Um, we could break up exercises for walking, like I had mentioned, 10 minutes down the driveway, 10 minutes back up the driveway. But again, it's just a matter of what is comfortable for patients. And then I have another question here. I will see what I can do is will this presentation be emailed? I'm sure there's going to be an opportunity on being able to refer back to this. And then after surgery, how long does one wait to do weights? I would refer to your doctor about that. So it usually can be 6 to 8 weeks for my breast cancer ladies that I speak to in my ABC class, or whatever your doctor's guidelines are. Okay. Um, Anything else? I really appreciate everybody joining. I see that there were 20 people that attended. That really means a lot to me. Thank you so much. I appreciate everybody's time, and I appreciate, thank you. Have a great day, everybody.